Hi there, my name is Karen Mercereau and I am an RN patient advocate, and I'm so glad that we have a chance to chat for a bit today. I wanted to talk to you about the field of patient advocacy. You know, we hear about it all the time. What is it and why is it? Perhaps even more important is why is it? Why is it important for all of us to know more about it? Well, according to research done by both Harvard and Johns Hopkins, that prior to COVID, medical errors were the third leading cause of death. I'm talking more than 250,000 people dead a year from medical error. Let me explain something else right up front, and that is, as I go through these numbers, and there's more of them, it's not that doctors have become substandard, or nurses, they haven't, but they're caught in a system that is based not on health, healing, wellness, and prevention. It's based on dollar bills. And so they're caught in that system. Another rather alarming note is that prior to COVID, both research, once again, from both Harvard and Johns Hopkins, demonstrated that pharmaceuticals, the meds we all take, is the fourth leading cause of death, right along with strokes. However, once that number was published, the National Institute of Health published their own paper and said that pharmaceuticals are the third leading cause of death prior to COVID. What is this all about? Why do we need to worry about the medicines? Well, if you are taking more than, say, 2 or 3 drugs, and many older folks are taking 15, 20 meds, there are interactions. Medications have interactions which can be harmful to your health. And if you don't know how to do that, then certainly an RN patient advocate can help you understand that. Another thing is that many pharmaceuticals, in fact, almost every single drug class, blocks certain nutrients. Why is this important? Well, let's say that you're chronically ill and you're taking Nexium or Prilosec or one of those other acid drugs. That blocks calcium, zinc, magnesium, which is critical for both brain and heart, and B12. Could that cause a problem for you? It certainly might. Anyway, there are several reasons why it's important to look at medications. Now, another interesting fact that has turned up in the field of patient advocacy. Back in 2004, the National Academy of Adult Learners did a national study looking to investigate the level of health literacy in the U.S. Care to take a guess? 12%. Yes, I'm not kidding. 12% of people were health literate. And what did that mean? That meant that they could read directions on a bottle, or they could recognize a word or two in a document. It did not mean that they knew what a pancreas is or what a thyroid actually does for us. And that was called health literacy. So nobody did another study until 2016, and this one was done under the aegis of the AHRQ, part of HHS, Health and Human Services. And what they found is that people who are more health literate are those who are more highly educated or making more money. So for most Americans who do not have higher degrees and perhaps do not have the resources, health literacy may be something you would want to think about increasing. And we could certainly, tell you where to look to get more accurate scientific information. And then another reason, we have all been taught since the time we were little teen kids that you have a doctor or doctors and they know all about you, and they diagnose a disease if you have one, and then they give you medications for that. That is traditional Western medicine or conventional medicine, and it certainly has a place. But let me tell you, there has been a tremendous amount of research globally going beyond those boundaries. What am I talking about? Well, you've heard about probiotics, right? Okay. Probiotics are because our intestines, and in fact several places in our body, are populated by large amounts of bacteria, viruses, protozoa, and fungi. Pardon me? Why is that? Well, when we were swimming in the ocean, one cell, we co-developed with other bacteria, viruses, etc. And that has stayed with us. In fact, 90% of the genetic material in our bodies, right here, is not human. We coexist. Anyway, so when was it? In 2015 or 14, there was a huge grant done to NIH to demonstrate the Human Microbiome Project, as it is known and now globally accepted. And if you upset the microbiome, then that can open the door to reducing your immune system and making you more vulnerable to certain, clinical conditions. Once again, an RN patient advocate can really help you understand this and teach you how to do this for yourself. Okay, and then there's one other, and then we'll move on, and that is something called, you might want to write this down, systems biology. And this is global and really emerged after the global blooming of the Human Genome Project. And what it says and demonstrates, scientific research demonstrates, is that everything in our body is connected. It's not, it's not just you have a cardiac, neuro, renal, pulmonary. We have all these systems and they're separate from each other. They aren't. And what happens in one system is going to have an effect in another one. And that, my friend, is very important when you're learning about your body. Okay, so now there's another little problem we haven't talked about yet. And that is misdiagnoses. Now, in 2015, the National Academy of Medicine, which is the top echelon of medicine in the United States, published a study demonstrating that, hang on to your seat, 12 million misdiagnoses in the United States every year. I am not kidding. 12 million. Why? Why is this happening? I mean, in the ER alone, you have a 40% chance for misdiagnosis. How are you going to protect yourself and your loved ones? You're going to do it by getting educated, by learning how to do this. The big reason when you read the study is that there's a lack of information. Healthcare providers, doctors, nurse pracs, physician's assistants, do not have the most up-to-date, accurate, comprehensive medical historical information in front of them when they make their diagnostic and therapeutic choices. So sometimes it's like shooting in the dark. And then you have 12 million misdiagnoses. And you know how much that costs our healthcare system? Hide your wallet. $750 billion a year. And you can protect yourself. Learn how. All right. Now, I've mentioned several times that I am an RN patient advocate. This is a role that I started, 20 years ago. And it's a new role for professional nursing. And it incorporates education, guidance, helping you learn how to be your own health advocate. Nurses historically have worked to heal major healthcare system problems. And that started back at the turn of the 20th century with a nurse named Lillian Wald, who started public health nursing in the tenements of New York. And it has continued. The latest major progression in professional nursing is the role of RN patient advocacy. So thank you so much for listening. I'm glad we had a chance for a little chat. You can reach me at Karen, K-E-R-E-N, at Patient Advocates, plural on the advocates.com. Karen at patientadvocates.com. I look forward to speaking with you. Thank you.